In a world increasingly marked by fast food culture, understanding how to construct healthy eating habits is crucial. Our next session, a panel discussion on the topic, Building Healthy Eating Habits, the Importance of Food Environments, will have us dwelling on this subject. So join me in inviting our moderator for this session, Tanya Jolliffe, founder, provider, certified integrative mental health professional, registered dietitian, nutritionist, and licensed dietitian at the LIT Wellness Solutions, and our panelists, Joe Villegas, founder and CEO of Paragon Wellbeing, Deekat Shekhar, CEO and founder of Bodyholic, Raheel Sadiq, motivational speaker, and Dr. Stephanie Bathurst, clinical sexologist, therapist, and healer at Bathurst Family Therapy, LLC. Please welcome them to the stage. And if I mispronounced any names, please take some time to claim your noun.
You're doing a fine job. All right. Well, we're here to talk about food, which following that last with the pictures, I'm glad we kind of transitioned a little bit. So the topic about importance of environments, it's a broader topic, so we're going to break it down, but we're first going to take a moment to introduce ourselves, kind of let everybody know who we are, what we do, in case they haven't seen us in one of the other presentations that we've done. I am the founder of LIT Wellness Solutions, and I am a non-diet registered dietitian, focusing on the mental health and the whole person. I wrote a journaling program, the Mindful Me Journey, and it's a tool not just for me, but for any practitioner who is trying to help their clients put language behind the emotions, feelings, what they do with food and why they do it. And that's my big contribution to the world, is to help other clinicians be able to help that language of, what am I doing and why am I a binge eater? Well, you have to understand what do you do and why you do it. You want to tell us just a little bit about you and what you do?
Thank you. I'm Deekat Shekhar, and I am the CEO and founder of a small company called Bodyholic, which is an international and global fitness and health community. So on bodyholic.fit, there's the workouts, but on the podcast, which I feel is the crucial appendix, that's where I try to bring cutting edge research down a notch so that we can all understand it, because I have that mission of making information accessible to absolutely everyone. And a lot of it is surrounding nutrition, so I'm very happy to be here today.
Go ahead.
Hi, I'm Dr. Stephanie Bathurst.
It's on. Just hold a little closer.
Sorry. Hi, I'm Dr. Stephanie Bathurst. I'm the founder of Bathurst Family Therapy. I'm a clinical sexologist, relationship therapist, holistic healer. I'm also a Pilates instructor, so we provide pelvic floor conditioning programming. We integrate food as medicine for some of our holistic treatment protocols for clients experiencing mood disruption, low libido or libido dysfunctions, and other presenting issues that impair their quality of life. I also provide education and guidance for herbal supplementation and sourcing.
Morning, I'm Joe Villegas, the founder and CEO of Paragon Wellbeing. We're a health and wellness coaching company primarily focused on employee wellness programs for small and mid-sized companies. The bulk of our programs focus on a holistic approach to wellness, everything from nutrition, physical health, mental health, and well-being, which is obviously a very important topic in the workforce today. But all of our programs are rooted in healthy behavior change and building healthy habits. So very excited to be on the panel with these folks today covering that topic.
That's great.
Morning. How's everybody doing? I do want to apologize in advance. A lot of people did ask me when I arrived. I am sorry to break it to you. I am not Dwayne "The Rock" Johnson, so I do apologize to a lot of you. But all jokes aside, my name is Raheel Sadiq. I am a motivational speaker just outside of the Washington, D.C. region. I recently lost 190 pounds. a lot of weight, I know. And I've been booking speaking engagements on multiple platforms and very excited to be here on this amazing panel to talk about this very important discussion about building better eating habits, because obviously I didn't have the best eating habits, losing as much weight as I did, but excited to be here and can't wait to get this kicked off.
Great. Well, before we jump into talking about environments, which is availability, quality, safety, affordability, and all those things, we have to first, I think, identify, because we're each professionals trying to help people develop nutritional health. Let's talk about what to us nutritional health even means, because I think what's the goal we're striving for? Let's identify what that goal is from our each perspectives.
I feel that the basics is known to most of us, and getting the adequate nutrition that we need on a daily basis. My point of view is a little bit more, I guess, focused on populations. And when I think about food health, I think about healthy food being accessible and getting rid of the food deserts. So that's kind of my approach, and there's a lot of strategies, but we can cover that another time. But so I'm kind of looking at groups and communities. That's my point of view.
Great.
Thank you.
Great. Dr. Stephanie? Sure.
When I'm thinking of food health, I think about a healthy body and how that's defined. And I think a healthy body is comprised of what that somatically feels like, right? So less of body form, which I think has been historically what we've focused on, the weight component of health. And I can understand why we as a field have focused on that more, because it's more easily objective, right? Objectively measured. We're wanting to veer away from that and more toward more healthier expressions of what it means to have a healthy body. So having a healthy body means a brain that is clear and active so that you can think clearly and articulate well in your Monday morning meeting, being able to climb a set of stairs. Wow, that was loud, sorry. So that your knees aren't burning or your lungs aren't burning, being able to have an active libido so that you can feel securely attached to your romantic partner, right? These are all closely objectively, expressions of health that can be measured. And I think our focus should be more on that, and food can be an expression or a way in which we can get people there.
Great. Joe?
So in our context, we talk about food health for the individual in terms of their relationship to food, right? So what we're really aiming for is not perfect, right? Because no one can really attain perfect, but is going for better. So being able to choose better options most of the time, but still be able to have fun, right? Food can be very comforting. It's how we connect and show care and love, at least in my family we do for sure. But in the long term, it's helping folks to make those better decisions over time and empowering them despite their situation, the food environment that they're in, to make those healthy choices.
Food. I love food too. But it's crazy. My entire life, I was actually pretty much born obese from birth all the way up until I was 27 years old. I was 405 pounds, and I had some horrible eating habits. And during those times, I was actually bullied a lot. I was made fun of a lot. And at that moment, and during those moments, a lot of times, what I would do is I would actually, because I was bullied so much, I would actually starve myself all day, and then I would eat probably at the end of the night all by myself, like thousands of calories, just pumping them in. And over time, the weight just kept piling on, the calories, and that was my relationship. I turned to food as a coping mechanism, and I had to really learn the hard way when I got to that, the top of the mountain at 405 pounds, that, food can be used as fuel. It can be used as a tool. It doesn't have to be just a coping mechanism when you are depressed. It's just a matter of having that plan, that structure, that outline. And thankfully, I was able to accomplished that, for the last 13 years of my training regimen and my process, and just blessed to be down, this 190 pounds. And now, anytime I have food, I really try to enjoy it. I really try to make that relationship better, instead of just hiding from my problems and using it as a coping mechanism. So, yeah, for sure.
Well, you guys have tapped into some of the things that we want to dive into, because one of the biggest things is we have lived in a diet culture. We have lived in a diet culture that is focused on how you look, not how you feel, focused on what products or services you're going to buy to lose weight, not on maintaining weight loss, not on the health side of it. And we are moving to a culture of wellness, and so much has been echoed in the last 3 days about people wanting to look at the whole person. So when we talk about environments, we have to talk about and Dee, you kind of set it off, so let's start. Availability. We assume everybody has availability. That's a wrong assumption. And so what they do have available is not always high quality. So when we want to talk about not just feeding yourself, we want people to think about feeding themselves with nutrient-rich foods. So let's talk about availability as we go through, and that nutrient-rich versus just calories.
I'm going to start off by saying something, and I hope it doesn't come off as judgmental, because it's really not. It's actually out of concern. I come from Israel, and in Israel there are food deserts, and they're a huge concern for me. And it's very hard to get to those specific communities. They're very closed. But in general, healthy, nutritious food is available. And when I came here, okay, I'm really sorry. This is not judgmental at all, but I was actually a little upset to see that even here in where I'm staying, things that I would normally eat are completely unavailable to me. So I'm making my way through it, but I'm feeling discomfort. And I'm bringing this forth because what I'm saying is it's really not accessible to many, many, many people. And I also lived in the States for a while, and I know that there are chains, grocery stores that are extremely expensive, and they have lots of nutritious foods. And then there's the places like 7-Eleven and convenience stores that are cheaper and very available, and they're, you've got them in every gas station, and that's an easy place to get food, get the calories your brain is telling you that you need, so it's available, and I'm going to go get it. And I think for the most part in the States, that actually might be the case, and I'm not sure, but I think that might be the case, and I think it is crucial to make healthy food the easy option. And that already goes way up. I'm not saying that anybody's at fault for choosing that food. That the food that I'd like you to choose isn't available. So going way up and starting to implement strategies in order to make it available is the key. And also, it doesn't mean raising. I personally don't believe that it means raising taxes on sugary drinks, because that's kind of punishing the taxpayer, but rather incentivizing establishments of grocery stores and farmers and bringing them to a point where they want to get to those areas, whether it's urban or rural, get to those areas and sell those nutritious foods.
Great. Dr. Stephanie, you're in Hawaii. You've got fresh everywhere, right?
Fresh everywhere.
But is it always accessible to everybody?
Yeah.
That's great.
I mean, yeah, you do still have McDonald's and everything, right? Like, you still have your fast foods that you can get, and people still enjoy them. And I think you can't talk about availability without talking about education, because if you don't have the foundation of information to be able to appreciate the difference of nutrient deficient preserved foods versus nutrient dense fresh foods. You can't make smart decisions for yourself and your body to feel the impact in the quality of life and quality of relationship that those decisions will have, right? If you don't have the understanding that 80% of your serotonin is actually created in your gut and highly, highly depends on the food intake that you choose. If you don't know that,
conversation and education about the second brain, right?
Right.
That's a whole new concept
Right.
for a lot of people.
absolutely,
Definitely.
right.
Yeah.
So yeah, I mean, I think education is key to being able to make conscious and appropriate choices for your own body.
Definitely. Joe?
Yeah, just to echo what Dr. Stephanie said, I really think when you're trying to solve a problem, it begins with awareness, right? And building education. And given the food environment someone is in, it's understanding what is available to them. So for me, like I live in New Jersey, very densely populated. I can go to a Wawa gas station today and get vegetables and hard-boiled eggs and like an actual nutritious meal. And I remember growing up, you were lucky if they had like candy bars or basically just like candy and cigarettes is all they were selling, right? So it's changed a lot. It's not so much, at least where I am, of what's available, but it's helping people understand what is available to them and then what to do with that. So if it's not the most nutrient-dense foods, that's okay, but giving them a set of like heuristics of like rules they can follow to make the best choices possible for what's available. I think that's probably
Definitely.
a great place to start.
Man, those are tough to follow. But for me, I think personally, growing up, so having a Pakistani descent, I grew up with a lot of great food. My mom was an amazing cook, and having, obviously her and family, close friends, I would constantly being around those foods. And even though it was great, it was, high carbs, oily, high saturated fat, and constantly I just was overeating, overcompensating, and I didn't understand what I was doing to myself. And I think to add to everybody's point on this panel, and the one thing that I try to preach to everybody that I speak to on their journeys is you have to be able to have the courage to be honest to yourself. I think the hardest thing is that we have in society today is you have the hardest time to tell yourself the truth. If I go out and get a large pizza from Pizza Hut, I know this is damaging my body. I know it. But at that time when I was growing up, I might have known it, but I just didn't care because the weight just kept piling on, and I was using it as a coping mechanism. So I think talking about availability, I think the bottom line is you need to tell yourself the truth. If you know you're in a position where you have easy access to a McDonald's, to a Burger King, to a Pizza Hut, I mean, I used to pound those down all the time, late at night by myself, because I was so ashamed to eat in front of anybody and everybody that it was easy. It's easy to go pay $10 at McDonald's versus to go to Trader Joe's and Whole Foods, which costs $4 for a lettuce and $4 for a cucumber. It's easy. And I feel like if you want successful results in health and fitness with diet, you need to tell yourself the truth that these bad foods are going to damage me, right? So make sure you have that discipline, have that structure, tell yourself the truth. And secondly, you have to find a plan, find a way to make sure that you don't use that food to cope with whatever you're going through. Don't find the easy way out. Make that plan to understand, you know what? I don't want this large pizza. I know now if I go have a large pizza, I just destroyed 2 hours of my workout. I know I need to save my calories for later. And even though it does taste amazing, trust me, I love pizza. I'm from New York. Joe's from Jersey, so he'll tell you pizza is a part of my blood. I now know when I have pizza now, I try to make it as a treat for myself. I don't have it every single day or every other night that I used to before. So I think that's the bottom line for me is just tell yourself the truth. You have great foods available. You have high quality fresh foods available, but be honest with yourself. If you're going to have this greasy meal, make sure you understand what it is going to do with you. And it's okay to live life. It's okay to have that once in a while, but just don't make it the norm. I think that's the bottom line for me. So.
You all have touched on several things, not just the availability, but quality. I feel like it's a double-edged sword. In my experience, I worked as a clinical dietitian. I've worked as a health coach for a number of years. I work with truck drivers. I hear truck drivers say all the time, there's nothing available, there's nothing available. Well, there is. You walked past it because what's sitting out on the counter is what they want you to buy because it's that whole profit margin, right? And so some of it is getting those companies to be incentivized, as you were mentioning, to put the healthier stuff, not banana, that's, but nuts and having sections of nutrient-rich food. So at the same time, Di, you also mentioned the other side of it is there is stuff available for sale and packaged in the United States that would never pass in Europe, would never pass standards. It has more preservatives, more additives. The food quality has been allowed to be marketed differently to us than it has to other people. Now, is that because we haven't stood up and said we demand it to be different? Most certainly. So let's talk about that. What steps can we begin to say, okay, this is what we've seen, but we want it to be different. As healthcare professionals, as people who in technology and the health space, what can we do to make our voice heard to say we want quality, we want it available, we want it at a decent price, we're tired of the propaganda. So let's talk about that a little bit with some strategies and solutions we might offer to begin to make our voice known.
I really appreciate what you just said. And I think that the education aspect of it is huge and empowering, and nothing can really move forward without it. That's what I do. I educate people on health. But it goes back to what I said before. Nothing can happen if I just teach people stuff, but they literally don't have it available, because when you're hungry, your brain is going to tell you to eat. Mm-hmm. And that's it. And like, move out of the way. I'm going to go grab whatever it is that I'm going to grab, and I'm going to eat it. So I'm not going to go from point A and drive a whole bunch of miles over to that affordable Trader Joe's, let's say, in the hypothetical world. Okay, so it has to be, there has to be a deep understanding of the aggressive marketing that there is right now in at least this country, the United States. There is aggressive marketing regarding snacks, very non-nutritious foods. A lot of it is geared for the kids. They're hurting our kids. I mean, I wish I could help in this case, because this kind of blows my mind. But it is crucial to actually do the aggressive marketing on the nutritious side of things, and educate with really go head to head with the giants of the snack foods and their marketing. And I'm just going to say that it has to be policy. There has to be lobbying, because it's not going to work without the government. And so there has to be a lot of incentives and regulations. And I guess people like us have to start lobbying a little bit more, I guess. Right?
We have to be loud. I mean, we can educate our patients all we want. We can educate our clients. We can make culture change within an organization, which is what a lot of us do in corporate wellness, right, Joe? But at the end of the day, the marketers and the big business, right, they're setting the mark.
It's very, very expensive to have communities that are obese. It is very, very expensive. And I think that once someone gives the government the numbers, that it costs a lot to have communities with all kinds of metabolic diseases, that costs a lot more. And then, money can start talking.
Dr. Stephanie, you got other thoughts?
So Dee talked much more on like a macro level, which is amazing and perfect, and everything you said I agree with 100%. So I'm going to talk a little bit more on a micro level.
Mm-hmm. Great.
I think when we are working with a client, because there's so much inundation of marketing like in your face actively on a regular daily basis, and that information is so flooding for the typical person, ourselves as well, right? Mm-hmm. Like we experience that too. And we're not next to them as they live out day to day, right? it requires a collaborative team of providers, not just one singular person, right? So especially in the beginning, when we're trying to habituate new lifestyle patterns and trying to help the client buy into a change process that is notably going to be uncomfortable, because any kind of change process is uncomfortable in the beginning, which is a natural deterrent for the continuation of that change. We want to build them up with as much supports as possible. So it really does require a team effort of providers to help them ground in the importance of making these changes and in directing them to trusted, third-party tested supplement brands or whatever it is that the treatment plan requires, because they're not going to be able to find that information on their own.
And in that collaborative effort, I'll just throw this out, doesn't it also include changing the language? Stop saying don't, don't, and help them understand do
Right.
and select and choose. And
I love that.
the language, it
More
makes
active,
all the
empowering.
difference. You know, you go to a diabetes educator. If there's any diabetes educators, I'm not trying to call you out, but the list is don't. And as a dietitian, I learned a long time ago, never ask someone to do something that you wouldn't do yourself.
Right.
That was the best lesson I ever learned in my internship. Well, I don't want anybody coming at me with a list of things I'm not allowed to do. Help me, empower me with what I can do, the choices I can make.
Right.
So that's that education part, but it's also collaboration. We ought to start talking in a positive, encouraging language. Joe, are you seeing that corporate-wide?
Yeah, for sure, 100%. So when we actually, to piggyback on what you just said, so when we go into an organization and work with them, we don't tell employees, don't do this, don't do that. It's what can we add in first, typically just habit-based. We don't even say, pick from this food list and not this one. We might start with something simple like, just try eating slower, right? You're ultimately going to get fuller sooner and stop eating as much. But ultimately, I think when kind of going back to the question originally, is the easiest way, at least in this country, to get things started is to vote with your dollars. If you're not going to go buy that candy, it's one less person supporting that effort. For us with corporate wellness, we go work with groups of 2, 3, 5, 800 people at a time. And so if we're able to have our ROI, we call ripple of impact, if we're able to have a ripple of impact where more folks are subscribing to a healthier diet, they're less likely to spend money on those less ideal foods, which then ultimately would lower the budget for marketing that they have and hopefully eventually extinguish it.
Right.
Would be the goal. But really, I think ultimately it's helping folks to empower them, show them, hey, it's not an all or nothing. Like, let's just get things started, get you going on the right track. Over time, that'll expand and they can choose better options. But really what's happening is they're voting with their dollars,
Right.
Buying healthier food.
I try to get my drivers to do that all the time. If you stop buying the candy bars, they're going to stop putting them out there.
Yeah.
Definitely.
No, that was great. And actually, speaking specifically geared towards corporate, I think that's a great point, Joe, and the team. I also feel as though you have to learn how to be comfortable being uncomfortable. And I think another issue that a lot of us are having today is you hit a quarterly goal and your boss or your manager is like, let's go out. Let's go out for dinner. Let's go out for drinks. Let's go out for appetizers. Let's go have a good time. And I'll just use myself as an example. Somebody who is very locked in, very driven. I try to tell people, it's easy to feel that pressure because your colleagues are having fun. You guys hit your quarterly goals. Everyone's having drinks. Everyone's having appetizers. Everyone's having meals, and they're high caloric intake. And it's easy, right? It's easy to be like, well, everyone else is doing it, so let me fall into it. Whether you're 4 or you're 40, peer pressure happens to all of us, man. It happens to every single one of us, right? It's easy to fall into that. So I feel like you have to be able to, from a leadership perspective, understand that if you hit your quarterly goal, try to recalibrate, shift your mindset to be like, you know what, let's go out and do something more on an activity side. It doesn't have to be someplace in a, in a drinks atmosphere, appetizer atmosphere, dinner atmosphere, high caloric, or on the flip side of it, it's okay if you are on that team and your boss is taking you out. It's okay to say, yes, I would love to come celebrate with my team for sure, but I'm not going to have this, this beverage tonight. I'm not going to have these appetizers tonight. I'm going to have a water and I'll have a salad. And because I have my own personal goals, I have my own personal missions, and I think that is really good. I think this is something that should be happening more, to be honest with you. I think it's easy, and I think that's the biggest problem that we're having, especially in the corporate world that we see here today, is falling into that trap of the peer pressure. Make sure you stick to your guns. I mean, there's so many times. The first year that I was training from 2010 to 2011, I didn't go on any vacations. I didn't hang out with any of my friends. I didn't go to any restaurants. I sacrificed so much, and I had a lot of support because they understood that I was on a journey, I was on a mission. So I feel like it can easily translate into corporate America too. It's okay to be comfortable being uncomfortable, and if people are around you, you have a good support system at home, with your friends, with your colleagues, they will support you. You just have to have the courage, build that belief that, okay, like I'm on a mission, I'm on a journey, this is how it's going to be. And again, from the leadership side of the house, just be creative. Of course, it's easy to, do the norm, but there's other ways. And I think from the leadership down, and then also the employees down in corporate America space, we can all be better. And I feel like those are some ideas possibly that hopefully could help out.
You hit it. Now, we only have 8 minutes left, and I do want to leave time if anybody has any questions. But you tipped on the whole safety, the emotional safety, right? We can talk about safety in environments all we want about food safety, but environmental safety. So in just a couple minutes each person, social media is everywhere, and family dynamics of families saying, oh, you don't like what I made, you didn't have 3 portions, and so give us a tip on how you think people can begin to navigate and own that emotional well-being for themselves from that emotional safety of food integrity.
I have to say that what was just said, what I think is the bottom line, the social support, the family support. I wrote a short book. I don't mean to plug, it doesn't matter, but that's the main thing that I talk about is the bottom line. The thing that research points to the most is that when you are so held and so supported, then you're pretty much good to go. And the thing is really the courage to reach out. I also work a lot with mindfulness, and everything that you said just really resonated with me. The feeling of just being uncomfortable and being totally okay with it. Again, but you do have to reach out for support there, because that really goes hand in hand. And just to touch on the Instagram feed, et cetera, all the feeds, unfollow anything that you feel is toxic, and make sure that your feed is as clean as possible, because I don't know if you're going to take the app off your phone. You might leave it on, but maybe you can cram it with all the stuff that is super positive, super supportive, and then you've got just a lovely support system on your app. Thank you.
Totally.
A lot of what I do in the support of my clients is psychology and somatics of food health and of body health, right? So, and I think the foundation of that starts with self-love and bodily respect and appreciation. So questions like what are the underlying function and needs for food intake for you, right? Like, why are you eating on a regular daily basis? Is it to alleviate boredom? Is it to ameliorate emotional pain or social anxiety? Is it to just survive and keep your body moving so you don't pass out? Or is it to optimally perform to become an athlete? These are all very different functions, and the fulfillment of food and the appreciation of food intake, or the choices that you make, are going to vary pretty significantly depending on the underlying function or the need there. So I think that's where we start.
Great.
So kind of to piggyback again, I think, and probably the psychologists in the room would agree, is one of, if not the most powerful force in the human mind is you have to stay congruent with how you identify yourself. Mm-hmm. So when we work with folks, we kind of have like a 3-step framework that we go through. Of the first step is educating people, making them cognizant of like what the right choices are. The second would be getting some emotional connection to that. If you're not emotionally sound in what that thing is, you're not going to do it, right? And the third is cultivating an identity that's congruent with that. So Raheel here is probably the perfect example of what I'm talking about.
Exactly.
Right? Like if I said, Raheel, we're going out for pizza, he'd be like, no, we're not. We're not doing that. We're going to go out for water and salad. Sounds like a hoot. I'm in. But is helping folks...
Sparkling water.
Right. Yeah, we'll do that. Start slow. We'll have it. is cultivating that identity, and then they're only most likely going to make choices that are healthy choices congruent with that identity, versus if they are down on themselves or negatively seeing themselves, have a negative feed on their social media, it just feeds into that spiral of making poor choices.
Exactly.
That was great. You are in Jersey. I do love Singa's famous pizza. So if you ask me for that, I might have to join you on that. But no, I know we're getting close to time here. But I think when it comes to social media, I think the bottom line is stop comparing your journey, your path to everyone else. You know, everyone tells me that they know me. If you guys don't know, I was in Men's Health Magazine twice. I was on NBC News. I did Fox 5 DC News on World Obesity Day. But I've cried so much. I struggled so much. I suffered so much. I lost my father in my hands. I gained 65 pounds during this process. I had to get back surgery done. A lot of people who don't know that, they might not see that on my story. I'm actually very open with it, but others might not be. So if you see somebody with a six-pack or you see somebody who looks great in a bikini, that's great for them. But don't sit there and say and think that their life is perfect. My journey was far from perfect. I had to fail over and over and over and over again. And it's not about how many times you fall. It's about, do you have the litigated gall to get back up? And that's the bottom line. So with social media, don't compare yourself to anyone else. Your journey is your journey. Own it, love it, appreciate it.
Oh, perfect. Can't say any more. Question.
Awesome. Thank you so much, everybody. Quick question, and just for context, in a previous life, I was professor of nutrigenomics at Mount St. Vincent University in Halifax, Nova Scotia. We had a dietetics program, and one of the things I did was help get dietitians their placements, and but then also, you know, coaching them through coaching. And one of the things that came out of my discussions, call it, you know, a meta-analysis, if you will, is that dietitians were saying, you know, orderly or healthy eating, insofar as how we need to retrain people in terms of food accessibility and food availability, it almost seems like you need to be disorderly, or you know, essentially you're having an eating disorder, so to speak. Because if you walk out and, you know, to your point, this notion of food deserts, it's not real food, is it? It seems to me it's really more entertainment than it is food. So the whole notion of, you know, marketing and industries, that's going to be a big rock to move. I guess the question is, as coaches, because I'm assuming a lot of you coach, what kind of support do you encourage in the home? So if somebody is trying to, you know, meet a certain nutrition goal or health goal, how much time do you spend in building the reinforcements in the home so that they might achieve that end? That make sense?
Yeah, great question. I love that. So your immediate food environment's where you live, right? You're there most of the time, say. So when we work with folks, the first thing we do typically is what we call a pantry audit. So we go through and we say, you know, kind of our law of gravity, right? What goes up must come down. Ours is, if it's in the house, someone's going to eat it. So it's going through making sure that those triggers are not there in the immediate at all. Like, donate what you can, get rid of what you shouldn't be eating, and let's restock with those good things. And then you're less likely to reach for a candy bar because it's just not there, right? We have this concept that we use, we call like just creating friction. So you want to create a lot of friction between you and the thing that you probably shouldn't be having. Meaning, if you don't have ice cream in the house, how are you going to get it? You got to get dressed, you got to get in your car, you drive there, spend money, come back, and then eat it. It's a lot of steps to make it happen. Where if you can reduce friction between the healthy food, if I just have a bowl of fruit on my counter, I can grab an apple and there's no friction there, I can get right to it. So those are kind of two quick and easy ones that are, I mean, anybody could do that, right? It doesn't take a lot of brain power, and it's something you can lead them through in a 20-minute conversation and they can do on their own. That's a great question, and my wife and I are working through that together quite frequently. No, it's so. And to Rahil's point before, right? It's kind of an 80-20. Like, you got to live your life and have fun. And I know for us, like, food's a very comforting thing, but I think it's setting boundaries around those things. And so, as an example, like in our household, we do like one fun dinner a week. So that's where we order out and eat the foods that we like to eat beyond just the healthy stuff.
Thanks. Barry, I'm sorry we're not going to have time. I hope you can grab, I know you come up and it just, your time is up. I hope you'll get with any of the panelists for your question. And thanks for this great conversation.
Thank you.
Thank you all.
Thank you for having us.
One thing real quickly. In the structural things you're looking at, I'm free to discuss this, anybody, look at where food goes that comes into your city. What we've discovered in Dallas is that many times when the food goes to the warehouses that go to the wholesalers, the warehouses are full and it goes to the dump.
Oh, that's a whole nother discussion.